So I'm going to talk about a very common problem but often neglected by us in practice. Centration of spectacle lenses is a crucial consideration in the satisfactory dispensing of spectacles. Proper alignment of the optical center with the visual axis ensures optimal visual performance. So frame selection, prescription accuracy, lens material and design, and facial anatomical characters can affect the centration of spectacle lenses. So this is a common scene that we see, the glasses sliding down the nose. We may have chosen the right frame, but if we used a high index glass, the glasses will tend to slide over the nose, and that will misalign the centration. So decentration refers to the displacement of the optical center of the spectacle lens from the patient's visual axis. It induces a prismatic error in the lenses, which theoretically can be tolerated up to 1 to 2 prism diopters. So just revising the Prentice's rule, which states that the prismatic effect at any point on a spherical lens is equal to the distance of the point from the optical center of the lens measured in centimeters multiplied by the power of the lens. So PT is equal to C multiplied by F. So more the decentration, higher the prismatic error, and more the power, again more the prismatic error. So a base in prismatic error is induced if a convex lens is decentered nasally, or if a concave lens is decentered temporally, and base out prismatic effect is induced if a convex lens is decentered out and a concave lens is decentered nasally. So this picture shows how a spherical lens can act as a prism if decentered. So this is the effect, that a patient is not actually looking through spherical lenses but through a prism. So the consequences of lens decentration can range from mild visual discomfort to significant visual distortion and decreased visual acuity. Patients may experience symptoms such as blurred vision, headaches, and eye strains if the lenses are not properly centered. So these are the symptoms so many of our patients are coming and telling us. But are we looking at the centration? Are we getting the centration done properly? Are we sending them back to the optician for centration? I don't think most of us are doing that. Moreover, because of the prismatic error, there may be a slight movement of the eyes, which can affect the aesthetic appearance of the patient. So we conducted a study on 150 students, and the key inferences from the data was that the frequency distribution of asthenopic systems shows that a significant portion of participants experience mild to severe symptoms such as headache, eye fatigue, blurred vision, eye strain, and burning sensations, especially for near work. Those severe symptoms such as double vision and flashes of light are less prevalent. So many of our patients who are coming to our OPD, ji, ऐनक तो लगा ली पर दिसदा नहीं हल्ले भी ठीक, थकियां रहंदियां अखां, सिर दुखदा है. So it may be a decentration problem. So the study findings are consistent with the literature which suggests that decentration can lead to asthenopic symptoms and discomfort in spectacle users. Although the mean IPD and OC measurements indicate that the spectacle lenses were moderate, generally well centered, but a significant proportion of patients still experience mild to moderate symptoms, especially related to near work. So all of us who are doing a lot of near work, students, academicians, doctors, our glasses should be very well centered. And the observations are as per the NSI standards, which suggests that individuals can tolerate up to 1/3 of vertical decentration and 2.5 millimeters of horizontal decentration without symptoms. However, even minor decentration can contribute to spectacle intolerance and discomfort, especially during prolonged near work. So what are the solutions? Precise measurements are the key to give a properly centered glasses. Frame selection should be done properly, and now there are digital centration devices which ensure proper centration of glass. So thank you.
So thank you, Dr. Seema, for touching this important topic, and I think I can see